Assalamu alaikum, masal khair. Good evening, dear guests, respected speakers, colleagues, and all the students. On the behalf of the Tropical Diseases Teaching Hospital and the Academic Club, I'm honored to warmly welcome you all to today's HIV/AIDS lecture series. This will be the start, inshallah. We're delighted by your presence and interest, and of course, it's an important academic and public health discussion. We're privileged to have you all with us. As we all know, HIV and AIDS remains a major global health challenge, particularly in resource-limited settings like our country, Sudan. Beyond its clinical dimensions, it deeply intersects with epidemiology, public health system, counseling, human rights, and social stigma. That's a big issue. In today's session, it's designed to address those critical dimensions in a comprehensive and practical manner that will help you and guide you throughout your practice. We're privileged to begin our first lecture today, and the title is HIV from Public Health Lens. It will be delivered by Dr. Umar Yaqub Muhammad Yusuf. He's a highly respected consultant epidemiologist. He's holding MBBS, MPH, and PhD degree. And his PhD degree was, in particular, the thesis was about HIV and public health. Today, with his experience and extended research work, he will highlight and give us the insight to enrich our understanding. Following that, we'll move to our next session today. It will be presented by Dr. Mohammed Hamdoun and Ms. Noon Ahmed. It's titled Counseling and Stigma in HIV Care. This topic is equally vital in achieving effective prevention, treatment adherence, and patient-centered care. This session will be presented to you, and we encourage active participation throughout the session. And of course, a discussion period will follow those presentations. Once again, welcome and thank you for joining us. Without further delay, I invite Dr. Umar Yaqub Muhammad Yusuf to begin the first lecture. Shukran, Dr. Umar. Start, please. Dr. Umar, feel free to unmute yourself.
السلام عليكم مساء الخير.
وعليكم السلام. مرحب بك.
Yeah, can you hear me? Good evening to you all.
Yes, we do. Thank you.
Yeah, thank you as well for giving me the chance to present this topic and talk to you. It has been a long time actually to participate or discuss any issue in my country. So I am actually happy to be with you today. My talk today is going to be actually about understanding HIV/AIDS through public health lens. So basically, throughout my career, I started with HIV/AIDS earlier in 2001. After completing my MBBS, I had some work to do with HIV/AIDS. So going into the topics today, I will talk to you about the following. First of all, about the contents of this lecture will be an introduction, and then we'll discuss HIV/AIDS briefly and public health, and then we will look into the clinical lens versus public health lens, and then we'll look at the HIV from public health angles, and finally we'll try to talk briefly on the HIV/AIDS from public health angle during the current war, which is unfortunate, and also we discuss about some important public health research issues. So going to the topic, as you know, HIV is defined as immunodeficiency virus. It attacks the immune system, and especially the CD4 T helper cells. HIV or AIDS, on the other hand, is acquired immunodeficiency syndrome, and this is the late and advanced stages of HIV/AIDS. Basically, it has been one of the biggest problems that facing many people worldwide, and up to date, the prevalence of HIV/AIDS has been increasing. However, some goes to the treatment and preventive measures, which reduces the epidemic to, and I can say, to something that is not acceptable, but is okay level. Today, the prevalence of HIV/AIDS is about 40.8 million. That is based on the last statistic in 2004. Which means it's about 0.7% of adults, and that is seven in every 1,000 people are having that disease. And then when I say prevalence, of course, I'm talking about the new and old cases. And when I say incidence, I'm talking about only the new cases. And the new cases in 2024 is estimated to be 1.3 million. Now, to discuss about public health, in definition is public health could be defined as the science and art of disease prolonging life, promoting health through organized effort and informed choices of society and communities. So this is a basic definition of public health. And public health cover a lot of disciplines, basically include medical biostatistics, which has to do with analysis of health data, and I'm sorry, which has to do with health data, and the second one is epidemiology, which is the study of the distribution and determinants of disease and health-related events in different populations. And then the third one is environmental health, which has to do with air, food, housing, waste, and chemical which affect the human health. And then, of course, it's important to also discuss about, as part of public health policy management, health services administration, planning, and financing, and then social and behavioral science. So basically, I remember during our our master degree, we use a mnemonic, which is like big elephant enjoy heavy snacks. Of course, we don't need to forget the other part of public health like nutrition, like child health and women health. So briefly, this is what public health is about. So if you want to look into HIV/AIDS in the context of public health, then we have to look into each disciplines and see its effect on HIV/AIDS. HIV/AIDS burden has affected Africa statistically, and if you know, today about 26 million people are living with HIV/AIDS, about 640,000 new infections in 2003 alone, and 2/3 of the global HIV burden is mostly in African region. Of course, the Middle East also has a high number of prevalence of HIV/AIDS, and there is about 530,000 people living with HIV/AIDS up till 2024 statistics. Overall prevalence in the Middle East is low compared to Africa and Southeast Asia. In this slide, I'm going to try to compare the clinical lens versus the public health lens or public health physician looking at HIV/AIDS. So what are the main focus when we discuss the clinical aspect? Of course, a clinician normally look at one patient and manage their HIV/AIDS and their symptoms, while in public health, we look into the whole population and try to control HIV epidemic. The second issue is the main goal of the clinician is early diagnosis and start and maintain highly antiretroviral therapy and try as much as possible to prevent opportunistic infections. On the other hand, public health view look into and try to control the new infection and try to reduce the mortality and morbidity in general population. Of course, the data uses related to the clinician normally uses patient history, lab investigation, physical examination, and of course treatment, in which the adherence and compliance to HIV/AIDS is one of the main factors that affect the clinician outcome. And we'll discuss that in the coming slides. While on the other hand, the public health look into surveillance system. And when I say surveillance system, which is defined as the ongoing systematic collection and interpretation, collection, analysis, interpretation of data. And also we look into the gap in HIV care and how it is continued today. And then, of course, another factor that we can look into is the prevention aspect. The prevention aspect, regard for the clinician part, is normally individual counseling, especially on the stigma issues, and also the pre-exposure prophylaxis, which is prevented to reduce and control the infection. Another part, like, for example, using condoms or preventing using the harm reduction program, which is also used, or the prevention of mother-to-child transmission. All these are parts that the clinician is concerned more about it. However, the public health angle combine both all those on at the same time. So the combination of prevention and scale of exposure prophylaxis plus mother-to-child transmission plus the needle exchange program those are the factors that looked into by public health physician. Of course, the treatment model normally goes into monitoring the CD4 and manages co-infections. On the other hand, the public health aspect standardize the antiretroviral protocols and talk about task sharing and other services. So briefly, this is what public health, I said, look into. So if you want to discuss the look into the public health lens through HIV, we would need to look basically into the different aspects. So the first issue we want to talk about, for example, WHO promotes public health approach to HIV by simply providing, for example, the antiretroviral treatment, or by fairing decentralization of care. Another organization, for example, like UNAIDS as well, set population goals, like the goal of 95 ending AIDS by 2030, which means like aiming for 95% of people with HIV/AIDS to have their status to be diagnosed, and 95 of them to have treatment to achieve viral suppression by 2025 or 2030. So this is one of the aim of UNAIDS. So basically, all the international organizations contribute and look into HIV management in terms of public health. And when they look into in terms of public health, basically here they consider the epidemiology, the biostatistics, the health management, the nutritional aspect, the woman and child health aspect. So basically, all of those are the factors that are considered. Now, from epidemiological point of view, of course, you have to look at, when you said you have to look at who gets the HIV/AIDS, in which community, and when, and what time. Because when you said epidemiology, you are talking about the health, the determinant and deterrent of a disease and a given population. So this is a basic issue you look into. And I have mentioned the prevalence. I said this is a new and old cases. And epidemiology, we look basically into the prevalence of a particular disease and try to calculate the exact number, and that is calculated by calculating the total number of people living with HIV at a specific time divided by total population. As I said, as per today, the worldwide prevalence is about 40.8 million. And the second issue is the incidence rate. Is the incidence rate now increasing or decreasing? When I said incidence rate, I'm talking about the new cases of infection. And I said now, the new cases, if you compare it between 2001 or 2010 to date, you will discover that there is a reduction in the new cases. And this is basically due to a lot of factors, such as the awareness programs that are going on, such as the good prevention measures that is used, and also the contribution of health education and promotion, and in addition to the huge financing from international community and through international organizations. Of course, in epidemiology, you also have to consider the mortality. And the mortality of HIV/AIDS has been huge if you look into it worldwide. And I said Africa has a lot of had a huge number of deaths due to the HIV/AIDS. If I remember during my early career in 2001, where I practiced in northern part of Nigeria, and 2001, there is huge, at that time, HIV/AIDS was a big problem in infectious disease. Per day, you may had about 5 or 6 people dying in the world. And the causes of that at that time of HIV/AIDS is not so well as per today. So the mortality during that time is much higher than today. And if I remember going also to 2012 and 13, when I had my PhD in University of Malaya in South Asia, they had a good awareness program. They have a good nutrition. They have a good public health program going on. So the mortality was reduced. So one of the issues that we look into is the mortality. So when you talk about epidemiology, basically it has to cover a lot of issues related to HIV/AIDS. But the biggest question is, do the clinician need to implement or to allow or to join with the epidemiologist in the clinical work or during the in hospital rounds? Is there any contribution? Of course, that is what happens everywhere. So there is a teamwork, and the teamwork contribute many doctors or many partners. Another important point also is occupational health. As I said, public health also consists of also occupational health. And when I said occupational health, it means you need to protect the workers that work from work-related hazards, including like blood-borne pathogens like HIV, including, for example, like infections through the body fluids or infections through the needle prick. And in this aspect, if we try to compare all a long time ago, for example, uh, let me say about 10 years ago, if you just look into needle prick issues, HIV/AIDS used to be one of the biggest problem because doctors and nurses and the hospital workers used to be contacting the disease through a needle prick. But if you look at it today, that issue has been almost resolved due to some go to the new technologies and so on. As well, also, the generally occupation and work site have considered many issues and many solutions to reduce the transmission. For example, from an exposure has been reduced severely, and it's currently, you can say, it's almost 0.03%. Another part of public health that we need to look into when we consider HIV/AIDS is the environmental health. And when I said environmental health, we focus basically here on external factors such as water, surface, and equipment, and how they affect health. This aim to make the environment safe and to try to reduce the spread, even though we know that some of those issues does not spread HIV/AIDS. I wouldn't want to talk about that in this lecture. However, we just need to acknowledge that environmental health, occupational health are part of the public health that contributes significantly to HIV/AIDS. With this now, I will try to also look into the issue that what happened to Sudan, for example, during the current war, from different international organizations. What I mean here, we try to look into the public health effect using the public health lens to look into HIV/AIDS. What happened to the HIV/AIDS during this war? What happened to the people living with the AIDS, and so on. So if we look into the UNAIDS statistics, the general prevalence of HIV/AIDS before the war, it used to be around 0.2% in Sudan, which is very low. Of course, please, you may correct me. This statistic, I'm not so, because I have not practiced in Sudan, and I always getting the information. So I'm sure that most of the people in Sudan will have the correct number and the exact values. But basically, UNAIDS are saying, for example, the people living with HIV/AIDS are about 41 to 48,000 people living with the disease at different ages. And the infection and death was about 1,900 related deaths. That is in 2023. That is just before the war started. And then the surface coverage before the war is about 46%. 46% of people living with HIV/AIDS status are known, and 28% receive antiretroviral treatment. So basically, this led to 7% viral suppression. So in summary of the cases of Sudan, that we are saying that 48 people are living with AIDS before the war, 11,000 people were on antiretroviral treatment, and as you know that the war started in April, and of course when the war started, there is a lot of issues that happen which led to a lot of crisis. So during the war, what happened actually during the war? Of course, we had, first of all, the facilities has been damaged, health facilities and the infrastructure, and there is interruption of supply chains either through the medication, and also the people living with AIDS have been displaced to different camps, uh, and also the warehouse for example, for the antiretroviral treatment in Khartoum has also been really affected, and the stock of the drug has been disrupted. And people, of course, during war normally try to save their lives, and people have moved from one town to another, and that really affected the people. And statistically, there was almost about 4,000 people were lost to follow up during this current war. And we just pray and hope that the war will stop, and we hope that people will be getting back. And in this time, let me just first of all acknowledge and thank our doctors who are in Sudan. We are outside, so our contribution was almost low and zero. But thank God to our brothers and colleagues who really put their life online just to help those people around and to provide the different care. So basically, from public health of view, this is, I said, one of the issues that happened during the war. And if you look today, for example, in Darfur region and Kurdistan, you can see how the everywhere is turned into camps, and those camps lack basic factors that for people to live with. And we shouldn't forget the disasters that recently happened in Al Fashir and how people are affected. And in this one, I'm just talking generally about all the people, but including the people that are living with HIV/AIDS. So you can measure and see how it's affecting all the people. So from public health of view, what will be the priorities during war? If there is a war, in contents of public health, in here I mean all the discipline of public health for HIV people, what will be the priorities? So the main priorities, the first one is to try to maintain the antiretroviral therapy continuity. That is very important issue. Try to decentralize drug distribution. Try to make sure that multiple dispenses communities are around so that the people can access the medication at different time. Of course, it is important to also be in touch with them through different methods, try to know where they are, how to help them, and try to prevent further transmission to other people through either awareness or through other campaign. So these are main issues that during war we have to look into. And of course, one of the biggest issues that we have to look into now is during the war is the nutritional aspect, because nutrition is more important as a public health component in terms of providing and building the immunity. And as you know, one of the biggest challenges is in HIV cases, try to build the immunity for the people affected with HIV/AIDS. And if you can see the refugees, for example, one of the biggest issues that they're facing is actually hunger, and there is no food. There is difficulty in distributing and maintaining food either through the government or through international organization. So nutritional aspect is another big issue. And also one of the transmission from mother to child as well is a big issue, because we have women that are delivering during this time, and how to handle those issues, how to provide the exposure prophylaxis treatments, or to run out any type of help. Community support is important for the people living with HIV/AIDS. So those are the factors that actually bother much regarding the public health issues. In this slide, I try to just look into the challenges over the time. So I will start by the stigma issue. I know that there's going to be a lecture today on stigma, so I'm not going to detail into that. But as you know, one of the biggest challenges in HIV/AIDS is the stigma issue and occupational health. I'm just putting 2001. That is when I started for the first time in northern Nigeria when I did my housemanship. I saw a lot of cases of stigma, and I have seen many doctors, some in fact nurses lost their life because of the stigma of HIV/AIDS, and that affected a lot of people at work. And so stigma was one of the biggest issues during that period. And of course, the health education system and health prevention, of course, reduces that, especially in Nigeria and Sudan. In 2004 and 5, uh, I was, I was, I was, I was, I was asked to join Western Darfur region. That is for my what do you call it, like housemanship, because I came from Malaysia after my master and I joined Western Darfur, basically Jinena region. And one of the issues that I was really work at that time was I joined an international organization to look into the HIV issues in the refugee camps. And at that time, the camps were not many, but at least there are a lot of cases of HIV/AIDS. So we have seen many cases, and we try to use the health promotion and health uh, uh, education. If we try to compare with today, today you can use the available technology to conduct health education or promotion, which become more easier compared to the time before. So the challenges have been reduced now, at least compared to before, to the older time, except the issue of the war that is affecting those areas. Another issue that I want to talk about is also the highly antiretroviral treatment and the research aspect. So the highly retroviral treatments was, since it started, it really helped a lot in treating HIV patients. And from public health point of view, there was the main problem we had was the adherence and compliance, and also for the HIV/AIDS to be taking their medication. So 2006 to 2012, I started my PhD in Malaysia in infectious disease hospital. I had about 1,000 HIV positive patients in which I follow up in a cohort study. And my topic was at that time adherence to antiretroviral treatments. And and what I try to look into, why should patients with HIV/AIDS who are really knowing that they have difficult health issues take their medication, and why should they adhere to it? And then also try to compare the different methods of medication provided in that hospital. And I also, in this part, I would like to thank Prof. Dr. Omar Nimeri, who at that time was in Umdurman Hospital. I remember I visited him and provided my thesis phase to conduct the study in Sudan. However, during some factors, I was asked to carry it in Malaysia. So the data collection and the whole study was carried out in Malaysia. But I met with him and I thank him for accepting and providing a lot of advice regarding my study, regarding my topics, and also he allowed me to join some of the areas in Sudan. We discussed a lot of issues. So research, what is a fundamental issue in public health point of view when you are looking at HIV/AIDS, and I'm sure currently there's a lot of publication, there was a lot of presentation, workshop, and conferences in Sudan and outside that look into the public health issues in HIV/AIDS. Of course, international organization plays a big role in terms of providing finances, in terms of providing support like UNAIDS, WHO, United Nations, and those provided a lot of support to, especially to countries in Africa and Southeast Asia through international collaboration and through research. For example, Malayan Gate Foundation provide a lot of work in that regard. In this slide, I would like to just share some of the issues that I published and discussed. For example, my thesis is published, and the title was Antiretroviral Treatment, and it was actually supported by international organization. It was supported by Malaysian government. So the study took 5 years. We look into 1,000 patients in a cohort study, and we try to look into the factors affecting adherence and compliance to HIV/AIDS. We use different methods. And another paper that we published was a factor affecting adherence to antiretroviral treatments in Kuala Lumpur. So we look into what are the factors that really increases adherence and compliance. And another issue, I try to compare between the therapeutic drug monitoring and the questionnaire, and this is published in Science Direct, is also available, and then the practical aspect. So briefly, in summary, I try to talk to you today about public health, uh, uh, about the HIV/AIDS, understanding HIV/AIDS through public health lens. And in that, I try to just briefly compare the basically the clinician lens, which plays a bigger role, and also the public health role. And we try to define what public health is, and we look into the different part of public health and their contribution or relation to HIV/AIDS. And in the short aspect, we also try to look into what are the actually HIV/AIDS situation in the current Sudan during the current war. And I pray really for Allah subhanahu wa ta'ala to make it easy and try that this war should stop now, and so that people will try to go back, and we try to provide help to all other people. And in the last slide, I tried to present the current the research that I carried on. And actually, this is my first time, believe me, since 2000 and 2013. After I joined Saudi Arabia, I joined the work in Riyadh in Ministry of Defense, basically where I work in research more than working in infectious disease. So basically my area was basically research. I had the research aspect in military hospitals. We look into different aspects of research, different aspects of prevention, and as well as epidemic control and so on. Last week, actually, I'm grateful to Prof. Bani, Ibrahim Bani. He asked me, he's my boss, we worked together in Jizan before, and he actually monitored me during my early master degree time, and he provided a lot of support. So he asked me if you can present this topic, and it was 2 days Harris slide for me to present, to prepare this rush slide. So please forgive me for the shortcomings, and I am very grateful to you all for that. So thank you. If there's any question, I'll listen to you.
Thank you so much, Dr. Omar Yaqub. Very elegant and very comprehensive breakdown of HIV/AIDS from public health aspect. We really enjoyed the session, and we open for the audience for any questions or comments. Please raise your hand or write in the chat box, and Dr. Omar will kindly answer your questions or your comments. If you have any questions, please raise your hands. Any questions يا شباب؟ أي تعليقات؟ اوكي شكله الكلام كله مرتب وما في أسئلة. شكرا دكتور عمر على زمنك. Thank you for your time and knowledge, and we welcome you to join ريان. اتفضلي يا ريان.
Okay, thank you very much.
ريان اتفضلي. دكتور ريان علي تنجة، اختصاص الباطنية. واشتغلت في مستشفى تروبيكال. feel free to unmute yourself.
السلام عليكم. كيف
سلام.
الحال؟ خير. كيف الحال دكتور عمر؟ شكرا جزيلا على البرزنتيشن المفيدة جدا كبداية لنا في الليكشر سيريز بتاعت ال HIV. احنا بدينا البوست من اليوم العالمي للإيدز، كان يوم 1 ديسمبر. فالليكشرز دي حتستمر إن شاء الله لحد شهر كذا لقدام. عندنا تجربة جميلة في الفترة اللي فاتت دي، مع مجموعة، مع دكتورة ميسون، مع دكتور أبو بكر، بس هم الليلة غايبين يعني. هم مع ظروف النزوح والشتاء. دكتورة ميسون في القاهرة عندهم مؤتمر برضو عن ال HIV، شغال الفترة دي إن شاء الله. ف يعني مرحب بك الليلة. أنت قلت طولت من إنك تقدم شغل لناس السودان، فإن شاء الله الفترة الجاية نسمع منك كتير إن شاء الله.
ان شاء الله باذن الله تعالى. انا بكون مبسوط جدا اشارك، واي وقت especially حتى لو في اي حد interested في الريسيرش aspect في الاتش اي في ايدز او any topics, please feel free to contact me و I'll be very glad والله to participate ان شاء الله. ونجي السودان، نجي نزور المستشفى. وزي ما قلت انا من الناس الان لكن قال له انا ما عملت براكتس في السودان، اشتغلت بس 8 شهور في زي هاوس مانشيب، ومنها مركب من السودان من 2001 تقريبا. بجي بس زيارات وبمشي. فايت واس to me it is very sad. لكن ان شاء الله we are on retirement ونرجع السودان، وان شاء الله نعمل a lot of contribution. فاي حد عنده اي question anytime he need anything to do with research, want me to do anything, I'm ready. Okay.
والله شكرا لك كتير يعني على ترحابك وكده. فمركز أم درمان طبعا اتنقل لمستشفى المناطق الحارة. احنا حضرنا من بداية إنه بيبنوا فيه لحد ما بقى مركز ويل استابلش وكده.
ما شاء
للأسف
الله.
جات الحرب واتأثر كتير، لكن هسي رجع بقوة إن شاء الله. احنا قبل فترة أو will be contacted عشان تعرفوا إنه السوشيال ميديا دي جرابد كل الناس مع بعض. كان عندنا يعني في صفحتنا بتاعت الفيسبوك a patient who is looking for his ART due to interruption. هو كان بيتابع، لكن الحمد لله بس عن طريق السوشيال ميديا دي قدرنا تاني نوفر له الدواء.
ما شاء الله.
فإن شاء الله الفترة الجاية حيكون في شغل أكتر وأحسن إن شاء الله.
ان شاء الله ان شاء الله ان شاء الله.
Thank you so much, Dr. Umar, for your time
Thank you very
and
thank you very
experience.
much ان شاء الله. Thank you very much. جزاكم الله خير. السلام عليكم.
جزاك الله خير. Thank you. طيب يا شباب، we're facing some difficulties بالنسبة للconnectivity when it comes to our next speakers, دكتور حمدون ومسنون. So أنا حقدم suggestion إنه نرحل كلنا التليجرام. حناخد لكم الرابط هنا ونمشي تليجرام، أو الخيار التاني to postpone the session ليوم تاني إن شاء الله. would you try تليجرام ولا we call it a day؟ لو ممكن تجاوبوا لنا في الشات بوكس. أنا حافتح الفرصة للناس كلها. you can unmute yourself في أي وقت، وورونا نعمل شنو في في المحاضرة الجاية.
والله التليجرام ده قبل كده جربناه برضو كان فيه مشكلة. أنا غيته قبل كده جربته، لكن الجوجل ميت برضو بيكون كويس، ولا شنو رأيكم؟
we're open. هسه ممكن نعمل آه absolutely يا هاجر. الزوم هو preferred، لكن our speakers ما قدروا. يدخلوا معانا. We're open to any suggestions from the floor. Google Meet.
السلام عليكم ورحمة الله تعالى وبركاته. دكتورة
عليكم
زلال،
السلام.
الجوجل ما
هاي.
بيشيل، أي ما بيشيل يعني أكتر من 100 أظن.
I think الحضور الليلة less than 100 will be okay.
Okay, you can try, no problem.
تمام. خلوني.
الو، السلام عليكم.
وعليكم السلام ورحمة الله.
مرحبا بكم جميعا يا دكتور عمر وكل الرفقاء. حياكم الله. هي شوفوا الحاجه الايسر، يعني الناس تحضر لها، ناس في عندنا ناس انا هم واجهوا صعوبه انهم يخشوا رابط. جزاكم الله خير، واختار الرابط برابط الفيس ورسلت الناس يعني
خليتي
يكونوا
واجبك صح؟ خليتي
يعني
واجبك.
كاتب صراحه كفه ووفه، ونقاط مهمه كثير جدا نتمنى انه نستفيد منها. الحاجه الثانيه، يا ريت لو في ملخصات للسيشنات دي عشان يزول له راجعة زي ما قال باريخية كده ويستفيد منها. ويكون في قبل المحاضرة يكون في زي 10 دقائق كده للأسئلة حقت المحاضرة السابقة، يعني إذا أمكن ذلك يعني كمقترح. وأنا شاكر لكم كثير ودمتم في أمان الله.
شكرا شكرا يا سليم. المحاضرات كلها موجودة في تليجرام، كذلك الفيديوهات المسجلة، وكمان اللايف في فيسبوك. هو موجود وبيكون متاح لمدة شهر تقريبا بعد المحاضرة. كذلك المحاضرات بتكون موجودة في يوتيوب لكل الناس اللي عندهم رغبة يرجعوا ليها، والمحاضرات السلايدز برضو بتكون موجودة. آم، يعني تأكيد من دكتور حمدون ومسنون أحمد إنهم ما حيقدروا الليلة نسبة للشبكة. حاولنا في تطبيقات تانية وما توفقنا فيها. ف I think we call it a day. نعتذر جدا عن مشاكل الشبكة، وربنا يديهم العافية، ما قصروا وجهزوا. إن شاء الله موعودين بالمحاضرة دي لأنها مهمة جدا. لما نجي نتكلم عن HIV AIDS لازم نتكلم عن الكونسلينج، ولازم نتكلم عن الاستجمة، وكيف نمهد للعيانين إنه تعال نفحص لك الإيدز بطريقة معينة وببروتوكول معين. أنا سعيدة بكل الناس اللي انضمت لنا الليلة. Ladies and gentlemen, as we come to an end of this session, I would like to express my sincere gratitude لكم كلكم for our speakers اللي قدروا يخشوا معانا. شكرا دكتور عمر. We deeply thank you for this comprehensive overview on epidemiology and public health aspects, which highlighted the global trends and the local challenges as well. Thank you so much for everyone. We have the links shared معاكم. بتلقوا الجروب الواتساب، قناة الواتساب، صفحتنا في فيسبوك فيها اللايفز، قناة اليوتيوب. اعملوا شير وشيروها لأصحابكم ولدفعتكم ولناس بيتكم ولكل من يهمه الليرنينج والأونلاين سيشنز. كل الماتيريال موجودة زي ما قلنا، وحبابكم انضموا لنا في أي وقت. إذا عندكم أي مقترحات ساعدونا بأنه تملوا الفيدباك فورم، وإذا عندكم أي تعليقات اتفضلوا. floor is open.
شكرا دكتور بلال، لك التحية والتقدير، وكل حاجة تكون فيها تحديات لكن نحن قادرين إنه نتجاوز التحديات، وإن شاء الله قادم أجمل وأفضل. وشكرا لمجهوداتكم، شكرا لصبركم، شكرا لزمانكم الكثر تدفعوه تفيد المجتمع السوداني. المجتمع السوداني يستحق أكثر من ذلك، خصوصا إن إحنا في تحدي حقيقي في ظل الظروف الآن وبعد استقلال السودان. يعني نتوقع بعد اختلافنا بالدول الأخرى والهجرة إنه ما معروف الظروف، إنه ربما يكون التحدي الآن بعض التقارير إنه يتأكد إنه كمية كبيرة يعني بعض، يعني سبحان الله انه اصيبوا بمرض المناعه وبعض الامراض المرض القلوبيه. فنحن محتاجين بجد لتوعيه كثيره، ومحتاجين لسبب لكل واحد فينا. أنا شاكر لك كثير، ونتمنى إنه ربنا يسترنا جميعا ونقدر نقدم التوعية الحقيقية للمجتمع السوداني. المجتمع السوداني يستحق. أنا شاكر لكم كثير، شكرا لكم كثير جدا، وإلى
شكرا
نتقابل إن
لك.
شاء الله.
thank you. شكرا. over to you سارة، نختم.
Thank you so much, my dear partner in crime. حقيقي ما كنا متمنين إنه ننتهي من اليوم ده بالسرعة دي، بس يعني زي ما بيقولوا خذلتنا الظروف، لكن of course لنا لقاءات أخرى. وزي ما قالت ريان وظلال still إحنا we are in the beginning of our HIV month. هيكون في more sessions to come and more interesting discussions and lectures inshallah. So stay tuned and wait up. Set your alarms وتابعونا في كل السوشيال ميديا بلاتفورمز حقتنا. شاكرين جدا لدكتور عمر كان معانا اليوم. بنشكر برضو السبيكرز دكتور محمد حمدون ودكتور نون، لأنهم they did all the effort عشان يحضروا يقدموا لنا، لكن إن شاء الله they will have the chance on the platform في وقت لاحق بإذن الله. شاكرين لكم لأنكم دائما بتدوني جزء من زمنكم و thank you for the support. وزي ما دائما بنقول أبقوا عافية، ولنا لقاء آخر بإذن الله.
تصبح على خير ومع السلامة.